In this video by Deckplate we will be discussing the link between service-connected mental health conditions and IBS. Some of the most common the link between service-connected mental health conditions and IBS experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The link between service-connected mental health conditions, PTSD, anxiety, depression, and IBS. IBS is a chronic disorder of the stomach and intestines affecting up to 15% of the population. It causes cramping, abdominal pain, bloating, gas, and diarrhea. New research from the University of Missouri School of Medicine has established a link between irritable bowel syndrome, IBS, and mental health challenges such as anxiety, depression, and suicidal ideation. The research highlights the need for health professionals to evaluate and treat associated psychiatric comorbidities in IBS patients to improve their overall health and quality of life. The prevalence of psychiatric problems including anxiety, depression, bipolar disorder, suicidal attempt or ideation, and eating disorders was significantly higher in the IBS patient population when compared to the general adult population. IBS symptoms linked to stress. Stress can have a range of unpleasant effects on your digestive system, including increased muscle spasms in the bowel, changes in how quickly food moves through the digestive system, increased sensation in your gut, which can make you notice pain or bloating more easily, increased gas, changes to the gut microbiome, increased intestinal permeability, which can involve inflammation and changes to your immune system. All of these changes can contribute to your IBS symptoms. PTSD can aggravate or cause IBS. Stress response PTSD is associated with heightened stress responses in the body, including the release of stress hormones like cortisol. Chronic stress and elevated cortisol levels can negatively impact the gastrointestinal (GI) system, potentially leading to or exacerbating IBS symptoms. Stress can disrupt the normal functioning of the GI tract, leading to changes in bowel habits and increased sensitivity to pain. Altered gut-brain axis. Emerging research has highlighted the role of the gut-brain axis in various health conditions, including IBS. This bidirectional communication between the brain and the gut can be influenced by psychological factors such as stress and trauma. In individuals with PTSD, disturbances in the gut-brain axis may contribute to the development or exacerbation of IBS. Shared risk factors. PTSD and IBS may share common risk factors, such as a genetic predisposition to both conditions or a history of childhood trauma. These shared factors could increase the likelihood of developing both PTSD and IBS in some individuals. Lifestyle factors. People with PTSD may engage in lifestyle behaviors, e.g., smoking, poor diet, alcohol consumption, that can worsen GI symptoms and contribute to IBS development. Additionally, individuals with PTSD may be more prone to developing unhealthy coping mechanisms, like overeating or avoiding certain foods, which can impact digestive health. Hypervigilance and anxiety. PTSD often involves hypervigilance and heightened anxiety levels. These emotional states can exacerbate IBS symptoms. Anxiety and fear can trigger or worsen abdominal pain, diarrhea, and other gastrointestinal discomforts. Anxiety and depression aggravate or cause IBS. Stress response. Anxiety and depression often lead to chronic stress, which can trigger changes in the body's stress response system, including the release of stress hormones like cortisol. Elevated stress levels can impact the gastrointestinal system, leading to IBS symptoms. Stress can alter gut motility, increase gut sensitivity, and affect the balance of gut bacteria, all of which can contribute to IBS. Altered gut-brain axis. Both anxiety and depression can disrupt the normal functioning of the gut-brain axis, which involves bidirectional communication between the central nervous system, CNS, and the enteric nervous system in the gut. Dysregulation of this axis can lead to abnormal gut function, including IBS symptoms. Increased sensitivity to pain. Anxiety and depression can heighten the perception of pain, making individuals more sensitive to discomfort. How IBS and depression work together. The symptoms of irritable bowel syndrome can cause a level of distress that looks like depression. Some people are so worried that their diarrhea, constipation, or other symptoms will flare up that they avoid going to work, school, or out with friends. They may focus less on their social lives and lose interest in activities they once enjoyed. They may feel restless or irritable. All of these are symptoms of depression. On the other hand, the mood disorder may influence the way people handle IBS. They may feel too tired or hopeless to bother changing their diet to ease digestive symptoms or think they can't treat their constipation or diarrhea well enough. Also, emotional stress makes bowel symptoms worse. Theories about connection between IBS and mental health issues. There are several theories about the connection between IBS, stress, and anxiety. Although psychological problems like anxiety don't cause the digestive disorder, people with IBS may be more sensitive to emotional troubles. Strong emotions like stress, anxiety, and depression trigger chemicals in the brain that turn on pain signals in your gut that may cause your colon to react. Stress and anxiety may make the mind more aware of spasms in the colon. What's the connection between our gut and our mind? The link between the brain and the gut is strong, and virtually every gut function is sensitive to stress. Most of us are familiar with the gut's reactions to different emotional and psychological experiences. Think about the expression butterflies in the stomach. This is because of the gut-brain axis. The brain and nerves that control your body are called the central nervous system, which is divided into two parts, the sympathetic and the parasympathetic nervous systems. Some say there's a third part called the enteric system, which controls the gut. The gut-brain axis is a term used to describe the two-way communication between the central and enteric nervous systems, linking the emotional centers of the brain with the functioning of the gut. Because of the gut-brain axis, emotions can impact the gut in a number of ways, and the gut can influence your mental state too. That's not to say that all gut symptoms linked to mental health are due to IBS. Anxiety, for instance, is known to cause everything from stomach aches to a change in bowel movements. Thank you for watching our video. Please don't forget to subscribe and like our videos.